Welcome to this edition of Clinical Clips, an accredited continuing education activity. This brief expert video will spotlight the daily hot topics from the conference.
Hi, I'm Ronald Oudiz. I'm a cardiologist from Southern California, and I'm here live at the CHEST meeting, October 2023, in beautiful Honolulu, Hawaii. And we're going to be talking about clinical clips of important findings that have been presented here at the meeting. And this is episode 1 of 2 episodes. This morning I attended a session presented on methamphetamines entirely, and it covered everything from its addictive mechanisms to the problem at hand that we're all facing in areas where there seems to be a huge increase in the number of patients with methamphetamine-associated PAH or MAPA. Dr. Balasubramanian and Dr. Sood and Dr. Melendrez and Dr. Kingri presented an overview of the problem as well as the issues related to the addiction and some of the findings that have led to our discovery that disparities between these meth-induced PAH patients and non-meth-induced PAH have between them. Dr. Balasubramanian also presented a poster this morning about these disparities. Interesting findings because they highlight the differences or disparities between these meth-associated PAH patients and the non-meth patients. These include differences in education, employment, housing quality, and poverty. Methamphetamine is a highly addictive derivative of amphetamine that was originally developed as a medical therapy for attention deficit hyperactivity disorder, narcolepsy, and obesity. It produces some euphoria, increased energy, focus, and decreased appetite, but importantly, it produces deleterious effects, including CNS toxicity and cardiomyopathy. Methamphetamine increases dopamine release to over 1,000-fold above basal levels within the first hour of taking the drug. This is about 12 times the release of dopamine you get from food, from sex, and other pleasurable activities. The group today showed that some of the areas involved, including most Western states in the United States, have a hugely disproportionate number of meth cases, and that these numbers are increasing over time. This group also highlighted the importance of dealing with these patients one-on-one, specifically dealing with their meth addiction. Because as we know clinically, as we follow these patients, despite the fact that we have good therapies for treating and we can slow the progression of the disease, the patients that are still using meth are dying at a much higher rate than when they look at the counterparts. They're patients who are not using meth. The next presentation is a real-world analysis of a large database that goes from 2015 to 2022. Thousands of patients that were followed for newly initiated prescriptions for PAH medications, and the non-adherence, that is, the number of days of no therapy, less than 80% of total days, defines non-adherence. In those subjects, the outcomes were much worse. And specifically, those outcomes included all-cause mortality, PAH-related ED visits, PAH-related hospitalizations, mechanical ventilation, and a composite outcome. And probably the most compelling here is that all-cause mortality had a 3-fold increase in risk for non-adherence to PDE5 inhibitors alone. Following shortly behind that is a risk of about 2.8 times the risk of mortality for non-adherence to using ERAs less than 80% of the prescribed days. So obviously a key priority is patients need to take their medications, and adherence is extremely important. The next presentation was the use of machine learning models to help predict outcome. And this was a study by Mayo Clinic using retrospective data in thousands of patients who presented with PAH and were treated over time. And interestingly, some of the findings here that the machine learning produced included just a diagnosis of chronic respiratory illness, a visit to a PCP, or a visit to a cardiologist that actually had a much higher risk for patients that had PAH compared to those that didn't have these characteristics. In addition, patients that were male and patients with underlying CTD, 2 risk factors we already know are associated with worsening outcome, were predictive in this machine learning model. The group showed that improved monitoring using machine learning prediction of clinical worsening events could lead to earlier intervention for these patients and thus improve the outcome over the long term. And finally, for our 4th clinical clip today here in Honolulu, there's a study that I was involved in called the EXPEDITE study. And this was a study using parenteral prostanoids to, if you will, induce patients and get them used to high doses of parenteral prostacyclin in their bodies, such that we could transition them and get them to higher doses of oral treprostinil in a much shorter time frame. And so this study was published and showed that the induction approach was successful, and we were able to successfully get patients to these high doses of oral treprostinil without the long wait and up-titration, starting patients de novo on the oral. So what was presented today in a poster session was the fact that we could actually assess risk by looking at the Compara model of risk that is used in the 2022 ERS-ESC guidelines, and showing that these patients' risk improved over time. We were able to show that these patients who were induced on the parenteral prostacyclin and successfully achieved high doses of oral treprostinil at doses that were clinically relevant achieved a low risk score, down from 2.0 at the beginning to 1.0 by week 16. So we not only improved the patient's score, but we got them on a high dose in a much shorter time frame with the induction strategy. Thank you so much for joining. Please join me tomorrow for episode 2 of Clinical Clips here in Honolulu, Hawaii at CHEST 2023.
We hope you found this activity useful and educational. To receive continuing education credit and to download your printable certificate, please return to the activity webpage and click on the Claim Credit button associated with today's clinical clip.